What's the best treatment for lower back pain? Is that tingling in your wrist a warning from your body that you need to see your doctor? Are you eating the right foods every day? When you're looking for answers to your general health questions, just ask Dr. Jim.
Hello, thank you for the introduction. My name is Dr. James Fedich. Thanks for tuning in for this episode of Ask Dr. Jim. We aim to answer those medical questions that people have that never get their query answered. We're going to answer questions that we receive from our viewers in a format such as this. And now, along with our first question, is going to be our lovely Nicole.
Dr. Jim, our first question is from Mary in Andover. She says she has a bulging disc in her back. What does that mean?
Well, that's a great question. I have a lot of patients and people ask about bulging discs in their back. It's something people hear a lot about, but it's not something that necessarily we all know exactly what that means. So I'm going to use my little model here to demonstrate a little bit better what a bulging disc is. First, we're going to talk a little bit anatomy. We have a bunch of bones and vertebrae in our back. There's actually 24 of them stacked up on top of each other. In between each one is something called the disc. The disc does two things. It helps space these bones apart, which allows for these nerves to exit in between. It also absorbs the shock. So as we're jumping, bouncing around, and running all day, it's one of our major shock absorbers. When we look at a disc in a cross section, what we'll see is that the middle of the disc is made up of jello, basically. It's nice and liquidy, and there's outer rings that hold that jello in place. When everything works well, it separates these bones apart, allowing the nerves to get out of there, and those go to control things in different areas, in the legs from the lower back and in the arms from the neck, etc. Now, sometimes these discs can do a couple things. They can wear out over time where they start to dry out, so some of that liquid just isn't in there as much. And they can also bulge or herniate. Now, those two things can be commonly misconstrued. They're very similar, but some slight differences. What a disc bulge is that instead of this disc being in a nice circle here, some of that disc material is now bulging or pushing out, hence the name disc bulge. Now, recent studies have shown about 15% of people walking around have at least one disc bulge and don't even know about it. The reason being is that if the disc bulges but doesn't hit anything, you won't even know it. As a matter of fact, the disc actually has no nerves in it, so if you have a disc problem, a lot of times you won't even know about it because you can't feel the disc. When they do become a problem, the disc bulge, is when some of that disc is getting close to that nerve. If the disc bulge is pinching, rubbing, irritating the nerve, we'll often get symptoms. In the lower back, a common symptom would be radiating pain down the leg, and in the neck, these discs can cause shooting pain into the arms. They often don't cause shooting pain, and it can also just cause localized pain depending on how it's rubbing the nerve and several other factors. Another important variation with disc issues is that disc can herniate. And when we look at a disc from the top, we talked briefly about the inside being a jello-y core and the outside being these rings or fibers that hold it. When a disc is bulged out, like we were just showing, those rings are still holding the disc in, which is good. When it herniates, there's actually a break or crack through those fibers that are holding it, and some of that interior jello is allowed to escape. Now, a lot of times that can be also a more minor problem where it's still just rubbing the nerve a little bit and causing some pain. It can be taken care of conservatively, but other times that piece can really get lodged loose and cause some more serious problems. So the answer of disc bulge is a pretty complicated one, but I hope to explain it pretty well. A disc bulge is just when some of that disc material is pushing out in a place it's not supposed to, often irritating a nerve. Disc herniation is where it's pushed out, but it's also broken through the protective rings or fibers around there, which can cause similar problems or sometimes worse. I hope that answers your questions. And now for the next question, Nicole.
Next we have Bob from Alamucci. He says, I had an MRI of my neck and my doctor said I have JDJ. What is that?
Well, that's a very interesting question from our audience. Thank you very much. What is degenerative joint disease, or DDD, of the spine? So that's another question we get a lot in practice. Arthritis happens everywhere in the body. In the spine, we call it DJD, degenerative joint disease. We can call it other areas as well. Some doctors will refer to it as DDD, degenerative disc disease, if it's the disc in the spine. It gets confusing. Also, you can call it osteoarthritis, different things like that. There can be a lot of the names for the same problem, which can make it confusing for patients. We're all referring to the same thing: DJD, DDD, osteoarthritis, spinal arthritis, spondylosis, all really mean the same thing, and it means we have some arthritis in our spine. Now, people understand a little better what arthritis means in other joints in the body, but spine's not something we see all the time, so it looks a little different. We use our trusty models here to show you some things that happen with DDD or spinal arthritis. So this vertebrae here, we have two bones in the model with the disc spacing in between, and everything looks nice and good here. This is a normal vertebrae. All these edges here are nice and smooth, you'll see. The vertebrae's disc looks nice and plump in separating these two, and all nice and smooth edges. Important thing when we're always talking about spinal anatomy is the holes where the nerves come out. The fancy name for that is intervertebral foramen. We don't need to know that, just at the hole where the nerve sneaks out. And these are all nice important structures. Everything looks nice and smooth, spaced out and healthy. Our next model here shows the arthritis process. Now, don't need to be too scared on this. There's different stages of arthritis, and this model represents a more severe stage of spinal arthritis, but allows me to demonstrate a little better some of the things that we're talking about. So first difference that we'll notice is that the space in between the bones is much, much different. In this model here on the right, we have a nice big space separating the two bones with that disc. In this model, you'll see it's almost bone on bone. And you've probably heard people talk about bone on bone with their knee or different conditions of arthritis, and this is literally what we mean. Now, in different joints, there's different spacers, but all bones are spaced by something, a meniscus, a disc, and if that spacer wears out, people say it's bone on bone. And this is what they mean, that there's not space between there and these two bones are rubbing. Obviously, two bones rubbing cannot be the most fun thing, and it can cause a lot of pain. So that's the first thing we're going to notice. The second thing you'll notice is that there's nice smooth edges on this other model like we talked about. And in this model here, we're going to see these rough edges here. So there's a lot of rough edges there, and those are actually bone spurs. So that's another thing that can happen in different parts of the body. Sometimes we get developed bone spurs really just about anywhere. People get them in their foot, ankles, knees, just about any joint we can develop bone spurs. And what that is an outgrowth of bone. The easiest analogy I tell my patients is kind of like stalactites and stalagmites in a cave. Those fingers growing down from the top and up from the bottom. And sometimes they can actually grow together just like they do in a cave, and bone spurs can do that as well. What they're actually trying to do is trying to stabilize the joint for the spine, but unfortunately they often cause more problems. What they can do is sometimes they'll actually rub together. You'll see them hitting or rubbing, or they can actually grow together. And the problem with that is that the vertebrae are supposed to be able to move around as you bend and twist, and if the bones are growing together, there's not a lot of twisting or bending going on. So that also causes a problem. Another thing you're going to notice from the top angle is that when we looked at that disc from before, we saw this nice supple disc in there with a nice jello-y, liquidy core, and these rings around the outside holding everything together. In this model here, we'll see it's pretty much just all dried out. Kind of looks like beef jerky over here. There's really not a lot of that liquid left in there. Those fibers, everything's just kind of dried out. What that does, in addition to decreasing that space in there for that nerve, this is actually one of the main reasons we lose height as we get older. If you see the difference in these two models here, that's not a whole lot of height there, but if you add that up, there's 24 vertebrae. Each one loses a little bit like that. That's how people shrink when they get older, actually. It all comes from these discs drying out in the spine. So that's what DJD is in a real basic sense. Some of the problems that it can cause are, like we said, they can rub together. The other main problem is you can see the hole for that nerve, which we've talked about a couple times. This nice big hole in here has gotten awful small in this model here. So that nerve can sometimes be pinched or trapped as it's coming out of the spine. It can cause a host of different problems. Other things commonly associated with arthritis in the spine are loss of mobility or motion, obviously pain, aches, and those types of things as well. So it can mean a lot of different things to a lot of different people. Some people have arthritis in their spine and not a lot of pain. One misconception with arthritis anywhere in the body is that rheumatoid and those types of arthritis can cause pain, but osteoarthritis in and of itself isn't painful. It's the effects of it. So like we talked about, the joints rubbing are painful, but the growth of the arthritis is not actually painful. It's actually just the side effects of it. So you can have arthritis brewing in different joints of the body, including the spine, and never really even know about it until it eventually starts causing some pain. Now, depending on, there's 100 different factors. There are treatments available for arthritis. They can range from simple over-the-counter medication to surgery all across the board. But most of them depend on different things, what it's affecting, and there's a lot of different variables and different treatment options available for them. So it's another good question about arthritis. It's something we get an awful lot. It affects a lot of Americans. I hope that answered your question.
Thanks for tuning in to this week's episode of Ask Dr. Jim. Submit your questions by email to info@villagefamilychiro.com or by mail at Ask Dr. Jim, Post Office Box 333, Alamucci, New Jersey, 07820.